Hi, this is Swati, Assistant Professor from SNS College of Pharmacy and Health Sciences. Today we are going to see the topic Adrenergic Neurotransmission and Receptors. First we will see the adrenergic transmission. So here we must consider the endogenous catecholamines of the adrenergic transmission. They are non-adrenaline, adrenaline and dopamine. So here the parent structure is catecholamine, that is beta phenyl ethylamine. See the structure of dopamine, norepinephrine and epinephrine. Next we are moving to the synthesis, storage, release and metabolism of catecholamines. So first it is starting from the epinephrine. So that epinephrine is converted to the dopa. That dopa is converted to dopamine. Dopamine is converted to the norepinephrine. This norepinephrine is stored in the storage vesicles of the nerve terminals and it is going to convert into the epinephrine. This is the biosynthetic pathway of the catecholamines. Next, the enzyme which is involved in the biosynthesis of the catecholamines are tyrosine hydroxylase, an aromatic L dopamine decarboxylase, dopamine beta hydroxylase, phenyl ethanolamine and methyl transferase. And the cofactors required for the biosynthesis are tetrahydrobiotryptin, oxygen, ferrous. And for a decarboxylase enzyme, pyridoxal phosphate. For dopamine beta hydroxylase, ascorbic acid, oxygen and copper. For phenyl ethanolamine N-methyl transferase, the cofactor is S-adenosyl methionine, which is a methyl donor. So see the biosynthetic pathway. And next, drug modulating the release. So what are the drugs modulating releases are, which is reducing the releases alpha 2 agonists, beta 2 blockers, adrenergic neuron blockers. And increasing the norepinephrine releases are beta agonist, alpha 2 blockers, tyramine, amphetamine. Next, termination of the biosynthesis of catecholamine is reuptake into the nerve terminals by norepinephrine transferase. Next one is dilution by diffusion out of junction cleft, which is followed by extra neuronal uptake. Metabolic transformation by methylamino oxygenase and COMT, catechol methyl transferase, orthomethyl transferase. Next we are going to the adrenergic receptors. There are three types of receptors. There are alpha receptors, beta receptors and dopamine receptors. Here the alpha receptor is again classified into alpha 1 receptors and alpha 2 receptors. Alpha 1 receptor subtypes are alpha 1A, alpha 1B, alpha 1D, and next alpha 2 receptors are subclassified into alpha 2A, alpha 2B and alpha 2C. Next, moving to the localization and effects of the receptors. First we are going to see alpha 1A. They are located in the heart, liver, smooth muscle, blood vessels, lungs, vas deferens, prostate, cerebrum, cortex and hippocampus. Their effects are contraction of vascular smooth muscle, promotes cardiac growth and structure, vasoconstriction of large resistant arterioles and in the skeletal muscle. Next one is alpha 1B. It is present in kidney, spleen, lungs, blood vessels, cortex and brain stem. Its effect is most abundant subtype in heart, promotes cardiac growth and structure. Next, alpha 1D, present in platelets, prostate, aorta, coronary artery, cortex, hippocampus. Its effect is on predominant receptor causing vasoconstriction in aorta and coronary arteries. Next, for the alpha 2, alpha 2A is present in platelets, sympathetic neurons, autonomic ganglia, pancreas, coronary or CNS vessels, locus coeruleus, brainstem, spinal cord. predominant inhibitory receptor and sympathetic neurons, vasoconstriction of small procapillary vessels on skeletal muscles. Alpha 2b is located in liver, kidney, blood vessels, coronary, CNS vessels, pancreas, platelets. It affects on predominant receptor mediating alpha 2 vasoconstriction. Next one is alpha 2 is present in basal ganglia, cortex, cerebellum, hippocampus. Predominant receptor modulating dopamine neurotransmission, predominant receptor inhibiting hormone release from adrenal medulla. Next, beta receptors. Beta 1 receptor is located in heart, G cells in kidney. Beta 2 is present in bronchi, blood vessels, uterus, liver, GIT, urinary tract, eye. Beta 3 is located in adipose tissue. Type of receptor. So all of them are GSCR, and its effect is receptor in heart producing positive inotropic and chronotropic effects. Beta 2 causes smooth muscle relaxation, skeletal muscle hypertrophy, and beta 3 produces metabolic effects. Thank you.